And welcome into To Your Health. In Alabama, we're fortunate to have the Alabama Department of Senior Services. It's a wonderful organization that takes care of the needs of seniors in our state. And of course, we're blessed with a lot of retirees, a lot of seniors that live here. The department that's running this is very concerned about the health of people in the state of Alabama, and they're very proactive for new initiatives. Today we have with us Nick Nyberg, and you are the program director.
That's right.
For the Alabama Department of Senior Services. And one of the things we talk about aging that most people fear is either dementia or Alzheimer's.
Right.
And you guys are taking some steps to address that, haven't you?
We are. And this, Alzheimer's and other forms of dementia today really is a public health crisis. And in Alabama, there is 65 and older that are formally diagnosed with Alzheimer's is just under 110,000 people. Now, what is not taken into account is under the age of 65, early onset dementia. There's plenty of people that have that.
And that can come in your late 40s.
That's correct.
Yes.
Also undiagnosed. Getting a diagnosis of Alzheimer's or another form of dementia, there's several forms of dementia. It's a very difficult thing to get a diagnosis from healthcare professionals. There's a variety of reasons for that. So, you may see 110,000 people, 65 and older, formally diagnosed with Alzheimer's in the state, but there's much more than that. And I have a personal connection to Alzheimer's in my family. My dad cared for my grandfather with Alzheimer's, and really it's a heartbreaking situation. So for those caregivers, all caregivers, but specifically for caregivers for those with Alzheimer's or another form of dementia in the state or even nationwide, I tip my hat to them. They're really true heroes.
Yeah, I have a good friend of mine who's since passed away who is starting to get dementia. And one of the first things he said, I wish you could just take my legs and leave my mind.
Oh, goodness.
And the crazy thing about it is this. A lot of, and I want you to listen to what I'm saying, a lot of people say, oh my gosh, that person he's forgetting, he's this. That person does not choose
That's right.
to have Alzheimer's or dementia.
Yeah, and it's one of the reasons that I've read about with trying to get a diagnosis of Alzheimer's from a medical professional. A lot of times in the beginning, doctors will say, well, it's just a normal part of aging to have that forgetfulness,
you hear that all
right?
the time.
Which, it can be, but a lot of times that can be exacerbated into Alzheimer's or other forms of dementia. And so we, of course, want medical professionals to take it seriously, and I'm not saying that they don't. But in Alabama today, from the years, from 2000 to 2021, Alzheimer's deaths in Alabama has increased 205%, almost that. And that's a big number. And so, and folks with Alzheimer's, it's just increasing, and that's why at the Alabama Department of Senior Services, we are really diving headfirst into trying to combat that and help people.
And what are some of the ways you're doing that?
Okay, so the one thing that we did just about 2 years ago is we approached the Alabama Department of Public Health for a partnership. Because, like I stated, Alzheimer's and dementia really today is a public health crisis. And we are so fortunate and grateful to the Alabama Department of Public Health and Dr. Harris because they agreed. We have been working with helping caregivers for decades. And over the years, we've helped a lot of people with Alzheimer's. But in the last couple of years, again, we're going headstrong into this. And so what we're doing is we've written some grants. Public health has helped us in some areas. We're really diving into education and counseling and training because a lot of folks don't understand what it is, what Alzheimer's is, and how they can help someone, how to interact, how to react to people with Alzheimer's. And so we're diving into doing a lot of training for people like hospital staff, specifically discharge planners or what they call case managers, emergency medical personnel, even law enforcement. These are our frontline workers who are approached and talking to people every day, and they will come across folks who have Alzheimer's or other form of dementia, and they need to know how to interact and react. And we're also offering respite services for caregivers so they can catch a break.
Yes.
And so just a lot of different things that we're jumping into, meals and technology and just different medical equipment that's specifically designed for people with Alzheimer's. We're able to purchase some of those things. So robotic pets was a thing over COVID that Commissioner Brown got into.
I remember
we can still purchase.
She sat here with a dog.
That's right.
Yeah.
She sure did.
And that's
yeah.
something.
Yeah.
Well, we hear about if you catch cancer early, you can maybe thwart the effects.
Yeah.
Is there something you can do if you catch an onset of either Alzheimer's or dementia to thwart the effects?
And things that you can do to try to keep yourself from
Yes,
getting Alzheimer's,
yes.
right? Healthy brain activities. Most importantly, probably, is your health. We talked about this even
Yes.
before we filmed here, but cardiovascular disease, blood pressure, diabetes, it's all connected. They sometimes coin Alzheimer's, the new phrase is type 3 diabetes. Things like reading books, puzzles, word searches, socialization activities like attending church.
Watch the Wheel of Fortune.
Watch the Wheel of
That's right,
Fortune.
and try to guess,
Exactly.
that's what it's doing, yeah.
Yeah. Good sleep is important, and so try to control your brain and not worry about things going on today and get some good sleep. Don't smoke, healthy lifestyle, socialization. And here's another one that I read about that I don't really hear much about, but I did read about it, and that's hearing impairment. We encourage people to get a hearing test, and a lot of folks, they may have some problems with hearing and they don't want to go get that test. Well, they need to, because there is a correlation with Alzheimer's and hearing impairment.
Yes, because if you're not hearing, you can't communicate.
Right.
Absolutely. Yeah. Well, thank you for what you're doing. Remember, it's just one step at a time.
That's it.
And you're taking the first step. And again, as we say, it's 1-800-AGE-LINE. If you want to call and talk to them, they have a wealth of information about different things to make your life better in Alabama. And we'll be right back right after this.